I'm Erez Raphael. I'm the CEO of Dario Health. I'm very excited to be here. I think it's an amazing event, and in a very short period that we are on the platform of OurCrowd, I must say that it's an amazing platform, and we see already the impact and their ability to push the company forward. So I'm running this company for almost 4 years, and in the last 4 to 5 months when we are working together, it seems like things are moving even faster for people that like us moving faster anyway. So I want to start with a few words about disruption in the healthcare industry. We have seen a lot of disruption in other industries. We've seen companies like Uber and so on. And one of the things that we are looking to see is whether this connected world and this internet and this community and social media world will be able also to impact the industry of digital health, or what is called today medical device industry. In order for such industry to be disrupted, it needs to be a collaboration between few parties together. This industry is highly regulated. We are talking about bodies like the FDA or TGA in Australia, Health Canada in Canada. We are talking about insurance companies. And in order for such a revolution to happen in the healthcare, we need a collaboration from few parties. And I'm excited to be here together with Ryan from Discovery Health. And we developed a product called Dario. And Dario is aiming to digitalize the whole diabetes industry. And when we were thinking about how we're going to do that, we had in mind these bulky devices that are being manufactured by the traditional medical device companies. And there is one big advantage that were achieved over the year and a lot of reputation by these companies, that is around the accuracy and the trust around these devices. The regulation bodies are supporting them, and it means that patients and users all over the world are using it in a very trusted way. On the other hand, we started to see in the last 10 years that there is a new boy in the neighborhood called the wearables. Companies like Fitbit, Jawbone, and companies like Apple started to approach the health industry. And by the way, they are calling it the health industry because they're approaching users, unlike the traditional players that are approaching the health care. You know, I need to take care of you because you are sick. When it comes to wearables, they are trying to approach health from a prevention standpoint. And when we were thinking about Dario, we thought, okay, we need to build something that is very user-centric. So our diabetes mobile platform implement both the software but also a hardware and a medical device that in fact integrating into the smartphone. And at the end of the day, this is what we wanted to achieve. We are having exactly the same results in terms of accuracy and in terms of the ability to provide trusted results to the user, but at the same time, we are considered a very wellness and lifestyle solution, so we are gaining from the two worlds. On one hand, we are acting like the Fitbit of the world from an engagement standpoint. On the other hand, we are also providing a trusted results, and we are already cleared by 4 regulation bodies all over the world. We are also fully reimbursed by another 5 bodies, which includes Australia, UK, Canada, Netherlands, Italy. And I want to show you how our device works in the next movie. So where we are today. So one of the things that I like about innovative businesses is that the innovation is not just coming from the product and from the fact that we are digital. I like innovation also from the aspect of the go-to-market. And one of the things that we did with Dario, we decided that we are going to make the life of our users easier, not just in the way that they are using our product. It's also going to be very exciting for them in the way that they are communicating with us when they are purchasing the product or when they are getting their supplies every month or every quarter. So on our platform, we are selling all our supplies and device in a direct-to-consumer way. We have a very strong unit of digital marketing when we are selling the devices and also then providing the supplies, and then we are engaging with our patient on a daily basis and sometimes on an hourly basis in order to make sure that we are supporting them from a consumer standpoint and also from a clinical standpoint. So the whole method proved to be very efficient. So today we are selling already in like 6 countries, including the US. The product is cleared by 4 regulation bodies, including the FDA. One of the brilliant things about this product is the feedback from the user. So we always believe that a real disruption can come mainly from consumers that are happy. So if you're going to Google on Dario or My Dario on a social media, Google or wherever, you can see a great feedback about our product. One of the things that are happening today is that the community of users is growing very fast. The revenue of the company is growing in an average of 20 to 30% from quarter to quarter. And one of the things that are happening in parallel is that we see a lot of very good results from a clinical standpoint, which means that users that are using Dario are checking themselves more and eventually are improving clinical outcomes like hemoglobin A1C or other clinical outcomes. So we think that we still have a way to go. And one of the visions that we are having, and this is why we are running everything on the smartphone itself, is to be able, based on all the data that we are capturing, to keep personalized the treatment to the extent that users will prick their fingers instead of 5 to 10 times a day for type 1 diabetic. We think that we can get to 1 or twice a day, where the rest of the measures will be created by a predictive analytics, where eventually we'll create a hybrid, an invasive and non-invasive solution for people with diabetes. So this is our vision moving forward. And in order to be able to expand our overall outreach, when we were thinking about behavior, it was one company or one insurer that is very innovative in terms of engagement and behavior, which is Discovery Health. And I'll let Ryan present his part.
Thank you, Erez. Hello. I'm here. I arrived. Thank you, Erez. It's a great pleasure to be here. Thank you to OurCrowd for hosting us. It's very exciting for us to be part of this. Discovery is a health and life insurance company. We are a company with a difference. Our core purpose is about enhancing and protecting the lives of our insured customers. We've got about 5.5 million customers around the world, predominantly in South Africa and the United Kingdom. And what we do differently is we try and change behavior of our customers to reduce their health risks, to reduce their mortality risks, and as a result, to make a huge societal impact, to improve the quality of life of those customers, and of course, to give us an advantage in the performance of our underwriting risk pools. This behavior change program is called Discovery Vitality. It's been in existence for about 20 years and is a sophisticated global wellness program that recently won an award at the World Economic Forum in Davos just a couple of weeks ago as the leading behavior change and wellness program in the world. The way that Vitality works is on the left-hand side, first you've got to know your health. We give you a set of tests and baseline checks, And then we give you a vitality age score, which you compare to your chronological age. If you're older on your vitality age than your chronological age, you're in trouble, you're in bad shape. If you're younger, you're going to live longer and you're in good shape. The next thing we do is we help you modify these risks by improving your health on the center of the slide. And we take you down various personalized pathways based on your risk profile and incentivize you to improve your health. And the more that you do to improve your health, the more you get rewarded on the right-hand side of the slide. We have various status levels from blue to diamond. I'm a diamond member, and as a diamond member, you experience the maximum rewards as a result of your complete engagement. We've seen spectacular engagement of our members over the 20 years, and as a result, this has improved their health and given us an enormous advantage from an insurance point of view. The big question people always ask us is, does Vitality work? Are your customers really better off? Well, let me demonstrate to you from a longitudinal study over 17 years of health data mixed with Vitality data, which demonstrates 10% lower admission rates in the highly engaged Vitality members relative to those that aren't registered, shorter hospital stays, 25% reduction in the hospital stays, and 25% reduction as a result in healthcare costs. In our life insurance business, we see that our highly engaged members live 8 years longer. Now, this is, of course, a combination of a selection effect, who chooses the program, and a behavioral change effect. We're modifying risk factors. But this 8-year difference in the QX, or the mortality curve, in our life insurance business gives that business an enormous advantage. The nature of risk around the world is changing. Many of us understand what's happening in terms of chronic disease. The Oxford Health Alliance 3-4-50 model talks about 3 modifiable lifestyle behaviors: how we exercise or our physical activity, what we eat, and whether we smoke or not, and how that leads to 4 preventable conditions, one of the 4 being diabetes, a modifiable condition which we can impact with our risk factors, which ultimately these 4 conditions will lead to 50% of deaths worldwide by 2020, with enormous cost to society and to the world. As a result, our Vitality program has evolved, and because of human behavior, behavioral economics, we realized we needed a much quicker reward mechanism to provide a much greater incentive for our customers on the go to change their physical activity. Physical activity has proven to be the most relevant change somebody can make in modifying their risk factors. And so, through a collaboration with Apple, we launched Vitality Active Rewards. So how Vitality Active Rewards works is that it synchronizes with a wearable device, an Apple Watch or whatever wearable device you may choose. We give you specific fitness goals and targets every single week. They appear on a very interactive app. You join friends to the app, and so there's social dynamics associated with achieving your goals. And as you individually and your cohort of friends achieve goals, you are rewarded every single week with free coffees, free smoothies, and other great incentives. You can make donations to charity every single week. And these weekly incentives have changed the pattern of engagement and behavior. We have seen massive reduction in mortality correlating to high physical activity levels. And with Vitality Active Rewards, we've seen a 25% increase in physical activity in about 300,000 members, sustained period over more than a year now, with more than 3.5 million rewards redeemed. It is quite phenomenal that with the Apple Watch, which we give to the customers for completely free, they pay nothing for the Apple Watch if they continue to exercise. The moment they stop exercising, they've got to start paying for the Apple Watch. And so in the active Apple Watch cohort, we've seen an 80% increase in incentive-driven behavior change. Discovery is about changing behavior. Dario is about incentivizing in real time, in a contextually relevant way, the behavior change of diabetic patients. With the impact of diabetes on the quality of life, on society, and on insurance pools, we're very excited to work together with Dario, this OurCrowd company, to try and change the lives of our diabetics and to deploy behavioral economics in health insurance like it's never been seen before. Thank you.